Anxiety disorders. These are the what-if disorders. People with anxiety disorders feel constant worry, fear, or dread, even when nothing's actually wrong. It's not just nervousness before an exam, it's your brain stuck in survival mode all day. Generalized anxiety disorder, GAD, is when you worry about everything. Panic disorder is when you suddenly feel like you're dying for no reason. Heart pounding, chest tight, can't breathe. And phobias? Those are extreme, irrational fears of specific things like spiders, heights, or crowds. Obsessive-compulsive disorder, OCD. Not just, I like things neat. OCD is a cycle of obsessions, intrusive, unwanted thoughts like, what if I stab someone? And compulsions, behaviors like checking the door 15 times to feel safe. People know it's irrational. They just can't stop. It's exhausting. Depressive disorders. This isn't, I'm sad today. Major depressive disorder feels like your emotions have been muted, like everything weighs 100 pounds. You lose interest in what you love, your energy disappears, and your brain whispers, you're worthless. Persistent depressive disorder is the same thing, just slower and longer. Bipolar disorder. This flips the emotional switch between depressive lows and manic highs. Mania isn't just happiness, it's impulsive decisions, racing thoughts, and thinking you're invincible. One week you're unstoppable, the next you can't get out of bed. There are different types: bipolar I, full mania, bipolar II, hypomania, and cyclothymia, mood swings but milder. Schizophrenia. It's not split personality. Schizophrenia is a break from reality. People hear voices, see things that aren't there, and have disorganized thoughts. Their speech may not make sense, and they might believe in things like government mind control. It's not always dangerous, but it is deeply isolating. It typically shows up in early adulthood and requires long-term treatment. Dissociative disorders. This is your brain hitting the emergency eject button. Dissociation means disconnecting from reality, your identity, or even your body. The most extreme? Dissociative identity disorder, previously multiple personality disorder, where the mind splits into distinct identities, often due to extreme trauma. Then there's depersonalization, derealization disorder, where you feel detached from yourself or the world, like you're watching your life on a screen. You're there, but it doesn't feel like it. Trauma and stressor-related disorders. PTSD is when the past won't stay in the past. Flashbacks, nightmares, hypervigilance, like your brain never left the battlefield, car crash, or abusive home. Then there's acute stress disorder, which is like PTSD's short-term cousin, and adjustment disorder. That's when you go through a major life change and your brain says, nope, I can't deal. Personality disorders. These are patterns of thinking, feeling, and behaving that cause serious problems, especially in relationships. They're split into 3 clusters. Cluster A, odd, eccentric, paranoid, schizoid, schizotypal, think social withdrawal, conspiracy thinking, or flat emotional range. Cluster B, dramatic emotional, borderline, narcissistic, antisocial, histrionic, impulsive behavior, unstable relationships, emotional intensity, or a lack of empathy. Cluster C, anxious, fearful, avoidant, dependent, obsessive-compulsive, not the same as OCD, basically fear-based personalities. They're deeply rooted and hard to treat, not because people don't want to change, but because these patterns often feel like who they are. Eating disorders. Not about vanity. These are serious mental health conditions. Anorexia nervosa is about control, extreme restriction of food, even when dangerously underweight. Bulimia nervosa is the binge-purge cycle, eating huge amounts, then vomiting, fasting, or overexercising. Binge eating disorder is binging without purging, often fueled by shame. Eating disorders have one of the highest mortality rates of any mental illness. Neurodevelopmental disorders. These show up early, often in childhood, and affect how the brain grows and processes information. Autism spectrum disorder affects communication and behavior. Some people don't speak. Others are just extremely focused or socially awkward. It's a spectrum, not a stereotype. ADHD, attention deficit hyperactivity disorder, isn't just can't sit still. It's a brain wired for speed, chaos, and distraction, impulsivity, hyperactivity, and forgetfulness that interferes with everyday life. Other disorders in this category include learning disabilities, like dyslexia, and intellectual disabilities, all of which impact development from an early age. Substance-related and addictive disorders. This isn't about willpower. It's about the brain's reward system being hijacked. Substances like alcohol, opioids, stimulants, or even weed can cause dependency, withdrawal, and compulsive use, even when it ruins your health or relationships. Then there's behavioral addictions like gambling disorder, where there's no substance, just dopamine-fueled self-destruction. Addiction changes the brain's wiring, which is why recovery is so tough, but very possible. Somatic symptom and related disorders. The body and mind are connected, sometimes too connected. These disorders involve real physical symptoms without a clear medical cause. Somatic symptom disorder is when pain, fatigue, or illness symptoms dominate your life, even if no one can find the illness. Illness anxiety disorder, used to be called hypochondria, is the constant fear of being sick despite reassurance. It's real distress, just not coming from where you'd expect. Final thoughts. Mental disorders aren't personal flaws. They're brain-based, emotion-driven, and shaped by trauma, genetics, environment, or all three. Millions of people live with them, manage them, and recover from them. Stigma only makes it worse. Understanding makes it easier.